Distal radius fracture again? I know. I just wanted to share with you this x-ray that looked seemingly okay. It just looked like a very simple distal radius fracture. Maybe there's a little fragment over here that needs to be addressed. If you look at the side profile, it doesn't look that bad. Overall, not so significant. And this is a CT scan. You can see that there's a volar fragment that is actually quite small. And you can see this intra-articular fragment doesn't look that bad as well. Every time when I tell patient that I'm going to put in a little camera to take a look at the wrist joint, it's basically this kind of camera. Pen-shaped camera that is very, very small, about 2 millimeter in size, is entered inside the joint. So this is how it looks like when I enter the joint, especially in cases with fracture. You can see on this left image, this fracture fragment is depressed compared to this fracture fragment. There is an obvious step, you know, like a little staircase. There have been studies that showed that about 1 to 2 millimeter of step can lead to quite a high percentage of arthritis, meaning degeneration within the wrist joint. But does that degeneration lead to significant problems in terms of your day-to-day function in life? It's hard to say. So we cannot really say that the severity of arthritis correlates with your clinical functional outcome on how you manage on a daily basis. But for sure, that if there is an articular step like this almost can lead to arthritis. So what we do through the camera is we try to lever up or move that depression of that fragment, raise that small fragment from here to here. So I managed to raise it up quite well. Now the fragment is sort of like at the same level as the rest of the bone, but you can see that there is cavity between the fragment as well as the bone. But this kind of cavity is really, really difficult to manage. You cannot get a perfect reduction, something that jigsaws together perfectly. It will never be perfect. So this is the best we could do. An intra-articular gap is not really an issue, but if there is a step like this, then maybe it can cause higher risk of arthritis. You know, having said that, not all surgeons put camera when they fix a distal radius. There isn't any strong evidence to suggest that putting a camera to take a look at the joint surface leads to better outcome. But personally, my threshold to put in a camera, it is quite low. The only time that when I consider putting a camera is when the fracture has reached into the joint, there is an articular step that is quite obvious, especially on a CT scan. Then I would try to put in a camera to make sure that my reduction is good.